Casey Scholl,
Tori Stencil,
Gage Tedder, Noah Mall.
Kirsten Betterman.
approximately 17 million people suffer from a specific phobia.
Based on a survey conducted, everyone in this room has a fear of something.
There are various phobias among people in society today.
First, we will discuss mysophobia, and second, we will discuss acrophobia.
Next, we'll discuss astrophobia, then we will discuss trypanophobia, and finally, we will discuss anthropophobia. First, I will discuss mysophobia. Mysophobia is a term used by psychologists to refer to a fear of germs, bacteria, microbes, and contamination. This information comes from Professor Michael Kairos Fapps, a clinical psychologist and director of the Research School of Psychology at the American National University, and the journal Australian Psychological Society, published January 2017. There are other terms people use for mysophobia, such as germophobia and bacteriophobia. A phobia is defined as uncontrollable, irrational, and lasting fear of a certain object, situation, or activity. A person can be so overwhelmed by this fear that they can go great lengths to avoid the source of the fear. One response can be a panic attack. A panic attack is a sudden, lasting fear for several minutes, and this happens when there is no real danger present. Mysophobia was first discovered when obsessive-compulsive disorder, or commonly known as OCD, became a disorder in the late 19th century in 1838. This comes from Daniel Wade, who is a licensed clinical social worker who specializes in behavioral and mental health support, in the journal Psych Central, published April 2022. OCD is directly linked to mysophobia. This is because 1/3 of people with OCD also have contamination fears. OCD is a mental health disorder where people feel compelled to perform repetitive behaviors. This is a result of recurring disruptive thoughts or ideas. People who have a family history of OCD, anxiety disorders, or an overall upbringing around focused on germs and cleaning problems and health problems are at greater risk of developing mysophobia. It is also common for people to develop mysophobia when there are outbreaks or high cases of flu, COVID, or any other virus. Because of this, people perform decontamination rituals. When you have mysophobia, people have performed hand-washing contaminations, washing contaminations, and an overall avoidance of the contamination. Persistent washing like this can lead to red, dry, cracked, irritated skin, discomfort, and wrinkles. Mysophobia, like OCD, can be treated through psychological treatments like cognitive behavioral therapy. One of the most common forms of treatment today is just one-on-one therapy, but overall exposure to cognitive behavioral therapy is good for small increments to the fear. Now that I've talked about mysophobia, now we'll talk about acrophobia.
Acrophobia is defined as an intense fear of heights that can instill a great panic or anxiety in those who might suffer from acrophobia. Dr. Timothy Legg is a board-certified both geriatric and psychiatric mental health nurse practitioner. He is also a licensed psychologist, and he graduated from the Pepperdine Graduate School of Education, published in the Healthline Journal in March 2019. Acrophobia has been around for many, many years, but the name acrophobia itself was actually coined in 1887 by an Italian psychologist and neurologist named Andrea Verga. The symptoms of acrophobia can vary slightly between an increased sweating or chest pain or chest tightness, as well as an increased heart rate while looking at or thinking about any heights. Another symptom of it can be the sensation of being dizzy, as well as feeling you might be falling or losing your balance, no matter how sure-footed or sitting down you might be, while just looking at a height. You don't even have to be on one, you can just look at it. Another symptom is avoidance. People who suffer from acrophobia might go out of their way to avoid a height. If the route you have to take to work or school involves a hill or cliff, you could completely change your route so that you never even have to look at it. There are a few ways to develop acrophobia, seeing as it's seen as one of the most common phobias in the world today. The main one is through a form of trauma. such as falling from a height yourself or seeing somebody fall from a height, as well as any real negative experience up on a height, like a panic attack or a nervous breakdown. The other ways to develop acrophobia are a little bit less traumatic, a little bit less physical in nature. It can be hereditary. If somebody in your family suffered from it before you suffered from it, you couldn't have inherited it from them and have been born with it out the gate, or you would just have a higher chance of developing it in general. Another way you can develop acrophobia is by learning the behaviors of people you know. When you're very young, if you know your grandma, your mother, your father, if they suffer from acrophobia, you can pick up the behaviors of being afraid of heights, like avoidance or dizziness or falling, when you look at one from them and internalize it and pretty much develop acrophobia yourself, even if you never really had it before. There are a few key treatment options those who suffer from acrophobia usually look at. Exposure therapy is a very big one. Exposure therapy is also considered to be one of the most effective treatments for anybody who suffers from a specific phobia in general. But for acrophobia, exposure therapy usually involves going outside and getting near a height, looking at a height, getting on a height, while in a safe space. It could be with your therapist or just with a very trusted person you know. You get yourself out there and you expose it so that it becomes more of the norm for you and you don't suffer from as much anxiety or panic that you did before that. Another very common one is medication. Beta blockers help keep your blood pressure and your heart rate steady so that you don't suffer as much from the anxiety that you would suffer from in a normal situation. Another very common one is decyclorine. It boosts the benefits of exposure therapy. So if you take that medication along with doing exposure therapy, you will make progress much faster than you would if you were just doing one or the other separately. Now that I have talked about acrophobia, Gage will discuss astrophobia.
Astrophobia is the extreme fear of thunder and lightning. The word astrophobia is derived from the Greek word astrape, which means lightning. It is a treatable phobia that both humans and animals may suffer from, and it is an unreasonable and overwhelming anxiety of lightning and thunder. It happens in many children, but by the time they become adults, they tend to grow out of it. It can occur in adults that didn't have it as children, and certain people are more at risk for astrophobia. For example, if your family has a history of anxiety, depression, phobia, and if they suffer directly from astrophobia itself. There are several symptoms, and these symptoms tend to worsen when alone and tend to get better when given reassurance about incoming storm. According to Corey Wellen, who has a PhD in psychology from Brooklyn College, in an article for Healthline published in 2018, if a person hears about a storm incoming, it can change how they plan for their entire day. After hearing news about an incoming storm, a person may have a panic attack either before or during the storm. Some symptoms of a panic attack include chest pain, shaking, nausea, trouble breathing, and numbness. These people may understand that these symptoms are overblown and unnecessary, but they're not really able to control it. Some other symptoms include a racing pulse, an urge to monitor the storm at all time, and an urge to seek shelter immediately. For example, just hiding under a bed or hiding in the closet. Although there are several symptoms, there are definitely ways to treat this. First, being exposure therapy. Exposure therapy is done by directly exposing a person to thunder and lightning. The second way is cognitive behavioral therapy, and this type of therapy is done with a therapist, either one-on-one or in a small group. The main goal of this type of therapy is to reframe a person's trauma of thunder and lightning. And the third is anti-anxiety medications, with the fourth being virtual reality. According to Dr. Yasser Salim, an assistant professor of neurology at Baylor University, from a tech prescription journal published in 2022, using virtual reality is a good way to help people overcome their fear of astrophobia. Using virtual reality allows people to simulate their phobia several times within a small time window, which allows people to overcome their fears at a faster rate. Using virtual reality also puts a person in a fake scenario where they are able to interact with their fear in a safe and calm setting. Now that I've talked about astrophobia, Tori will now discuss trypanophobia.
Trypanophobia can be defined as a fear of needles, syringes, or procedures involving injections. This information can come from Erica Serino, who is a global writer and artist that specializes in human and animal health, in which she stated in the journal Healthline that was last updated in September of 2018. Trypanophobia has not always been around. In fact, it wasn't discovered until the invention of needles and syringes. Needles were invented by an Irish doctor named Francis Ryan in 1844, and syringes were invented by a Scottish doctor named Alexander Wood in 1854. This information comes from Paul Perriot, who has a degree in psychology from the University of Central Florida, in which he stated in the journal CSL Bearing that was last updated in June of 2021. Although these two inventions were a huge breakthrough in medical history, where there's a positive, there's also a negative. The positive being the huge medical breakthrough, the negative being that over 19 million people suffer with trypanophobia today. This is a problem because it inhibits people from getting necessary vaccines, shots, and medical procedures done that could be life-saving. Trypanophobia is mostly present in children and diminishes as they get older. However, this is not always the case, as many adults suffer with trypanophobia today. There are many different reasons as to why one may develop trypanophobia. These include a negative experience or a childhood trauma that is brought on by a specific object or event, childhood phobias, genetics, a sensitivity to pain, a fear of restraint. Those with trypanophobia can also be hypochondriacs, in which they are overly obsessive about their health. Trypanophobia can also be a learned response. And finally, the last cause is due to severe stress. With the many causes, there are also many symptoms. These symptoms include severe anxiety, which can cause dizziness, fast heart rate, and nausea. Insomnia is also a common symptom, as well as fainting, high blood pressure, violence towards doctors or nurses performing the procedure, and avoidance of medical procedures. And as mentioned earlier, it can be life-threatening. These symptoms interfere with the quality of life of the patient suffering with trypanophobia. These symptoms are present at the site or thought of a needle or medical procedure. Although there are many different causes and symptoms, luckily there are some treatments. These treatments include cognitive behavior therapy, exposure therapy, and medication. Cognitive behavior therapy is the most effective and most widely used, as it allows the patient to explore their fear and learn to cope with it. Exposure therapy, hence the name, exposes the patient to the fear until it is no longer a fear. It allows the patient to change their mental and physical response to needles. Finally, medication is also used when therapy does not work to treat trypanophobia. Medications that are commonly used are sedatives and anti-anxiety meds that decrease the symptoms of trypanophobia. Now that I've talked about trypanophobia, Casey will discuss anthropophobia.
Jamie Herndon, a licensed psychologist with a Master of Public Health degree from the University of Carolina at Chapel Hill, in an article for Healthline published in April 2018, states that anthropophobia, also known as social phobia or social anxiety disorder, is defined as the fear of people. This phobia was first described by Hippocrates in early 400 BC, and before the term anxiety was used, this condition was simply described as shyness or nerves disorder. Very little information was known about this phobia at the time, and therefore few people received treatment for it. Advancements occurred during the 18th century, when European psychologists and psychiatrists started looking further into phobias, specifically anthropophobia, and this research brought to light the idea of mental disorders. However, it wasn't until the 20th century that the study of anthropophobia, or social anxiety, received proper recognition as a discipline. Anthropophobia is classified as a mental disorder in which a person has a worry concerning social situations that does not go away. Specifically, it deals with the fear of interpersonal relationships, such as offending others, being watched, making eye contact, or feeling judged. Dr. Leafy Thomas, an OBGYN who has a master's in gynecology and obstetrics from the Government Medical College, University of Calicut, in an article for Medical and Life Sciences News updated in April 2021, says that anthropophobia is most commonly seen in children and middle-aged women, but approximately 12% of all adults struggle with this phobia, not including the high percentage of people that have this condition without it being recognized. Anthropophobia is caused by many things, such as adverse experiences or events, learned behaviors, a family history of anxiety disorders, changes in brain functioning, or betrayal from loved ones. People with adrenal gland problems, which produce stress hormones, can also have a higher likelihood of anthropophobia due to the anxiety symptoms being heightened and unable to be managed effectively. There are many symptoms of anthropophobia, including avoidance of crowds or certain people, major anxiety when in social situations, or physical sensations such as rapid heartbeat, shaking, or sweating. Even though you may think of anthropophobia as only becoming an issue when in large groups of people, the symptoms of this phobia can arise whether the person is by 1 or 50 people. On the other hand, there are many ways to manage this phobia. Therapy, relaxation training such as meditation, guided imagery, or breathing exercises, and medication are frequently used to help those with anthropophobia. Specifically, exposure therapy is used to repeatedly and sometimes gradually expose the individual to situations that typically evoke anxiety. Exercising regularly and maintaining a consistent sleep schedule can also help with the management of anthropophobia. It is crucial to drink lots of water and limit high doses of caffeine, as both dehydration and too much caffeine can affect mood and symptoms, for example, feeling jittery or on edge. It is also common for people with anthropophobia to isolate themselves when the anxiety surrounding it gets too big to handle. To avoid the symptoms that may make this phobia worse to handle, talking to loved ones often is crucial.
First, we discussed mysophobia. Then we discussed acrophobia.
After that, we discussed astrophobia. Then we discussed trypanophobia, and finally we discussed anthropophobia.
There are a variety of phobias common among people today in society.
Because 19 million people in America deal with a phobia,
Awareness of the widespread variety of phobias in our society today is crucial.